everybody. We're back. It's another episode of putting some fun back into your dysfunctional life with myself, Amy, and my friend Buck. I'm a psychotherapist with about 35 years of experience, and um, I'm retiring now, but I still think therapeutically sometimes. So, and I'm here with Buck, who I've known since I was like 12. So, take it away.
Hi, I'm Buck. I have been under psychiatric care since I was in fourth grade, where I was diagnosed with obsessive compulsive disorder, um, touching the wall, turning the light off and on, having to do things 7 times. Everything had to be symmetrical. Um, and now I'm here. I am diagnosed with bipolar, um, which with medication can be better. And my dysfunction of the week, let's see. My dysfunction of the week is that I've been called back for 2 major television things to the point where they call to ask my size, when I'm available, can I do, when am I available for fitting, uh, then having me do a script again, and then telling me that the director really liked me, and then nothing.
Oh, crickets.
Nothing.
That's terrible.
It's so
That's
frustrating.
frustrating.
It's
Yeah.
so close, and it's got to come down to how you look or how do you
Right,
fit
right.
what the director has in mind. But I'm telling you, it's really, really frustrating.
Oh, it's
Um,
annoying that they don't contact you and tell you. At
yeah,
least tell like we went with somebody else. We
yeah.
loved you, but you know
And one
that's
was a TV show for CBS that I have been called back 8 times.
gosh,
8 times. And twice called back from that.
that's
You know,
obnoxious. Yep.
it's like, you get
Please.
so up and then you get so down. And
Oh,
that's the
of course.
life of an actor, but it would be nice to
Yeah.
just get one thing. So, Amy,
I
what
get
is your dysfunction
that.
of the week?
Well, last week my dysfunction was that I went to a dental appointment on the wrong day, and this week I didn't. I messed up another appointment. So I was kind of doing some stuff at home, and I knew I'm supposed to have this mammogram, and I thought it was at 2 o'clock. I had it down in my book on my phone, and I'm sitting there kind of going through some stuff, and I get this text that says, "Are you in the lobby? Your appointment's in 10 minutes. Let us know if you're here." And I was like, "Crap, I'm not there, and there's no way I'm going to get there." So fortunately, they have it so that like text in if you're not, and or to reschedule or whatever. So I just called them back and I said, I just messed it up. I messed it up again, and my husband was like, "You should write it down, have a book." And I was like, "I would have written it down wrong too. How would that have changed things?" So, but I realized like there's a portal, a patient portal for my doctor's office, and all my appointments are in that portal. And if I would have just looked at that, I would have seen what time it was. So, but
Yeah,
I rescheduled it for Monday, and that's what I'm gonna do. So,
yeah.
and it was okay. She kept going, "It happens, it happens," and I was like, "But it keeps happening to me." So I have to get better about writing down appointments or putting them in my schedule correctly because that's just crazy. Anyway,
You know what I do? I have the doctor or the receptionist write down the next appointment. And
yeah.
then I have a drawer that I just throw it
Oh,
in. So then I
and you
know
right.
that in a couple of days I have an appointment. They're very good at calling me too.
I know that's the thing is like
They're good at
I actually,
calling me. So,
yeah, yeah.
but
I
I have a drawer and I can just pull
That's
it
smart.
out and I go, oh, that's
You're
the
brilliant.
same with all my blood work requests go into
Yeah,
that drawer so
that's
that
probably
I
smart.
know they're all
Because
there.
I know I have a dentist. I have a dentist appointment tomorrow. I have mammogram on Monday. I have a sleep study I have to do at the end of the month, and then I have another appointment where because I'm allergic to had allergies to amoxicillin and some other penicillins.
Oh,
They actually have a clinic where they like reintroduce the meds so that you kind of get over your allergies, which I don't understand how they do that, but I got an appointment to do that, which I think is kind of cool. So hopefully I'll
yeah.
come out of that without having allergies to the meds that I've had allergies to. So
Well, especially amoxicillin,
I know
because
it's a good one.
yeah, it it's
It's
used a lot.
absolutely,
So,
yeah. I had that
having
big
that
reaction.
option, you
Yeah.
know,
So it's the my because it was amoxicillin and then citromycin, which I guess is the same class. That was the one I had this huge. I don't. Oh, was that you? A huge
okay,
reaction to that. A huge like allergic reaction with not anaphylaxis, but a huge rash like all over my body
yeah,
for that itchy rash, horrible itchy rash. I ended up in the hospital because it was
right.
so bad. It was all over my body, and I was like, I'm just gonna wait it out. It's just I'm gonna finish this med, and then it'll go away. And then it started to creep up my neck, and I was like,
Uh,
oh no, it's going on my face.
yeah,
I'm not having shit on my face, so
yeah,
that was
yeah.
so.
I know.
Anyway,
It's
but there
funny
again, I
how
hope.
we wait.
Yeah,
Sometimes we just
yeah,
wait.
just kind of hoping.
You know,
Yeah,
I had
yeah,
I had an infection in my lower body, and they were giving me Bactrim. So
yeah.
it's very strong. So at night, my legs couldn't. They I had restless leg like I've never
Uh-huh.
had, and
Oh,
they
welcome
hurt.
to my.
My legs
Yeah,
hurt.
yeah.
So it's like,
It hurts after a
oh,
while.
it's just the medication working. The medication is doing it. But finally, I couldn't stand anymore, and I went
Oh,
in.
it's awful.
The doctor said to me, "Why did you wait?"
Yeah,
I said, "Well, I thought it was work." She goes, "No, you're allergic to it. Why do
right.
you
That's what.
think that? Why do you think that that happened? That doesn't happen unless
Oh,
you're allergic to it." So yeah. So
not.
when
Yeah,
they
restless leg is the worst.
yeah,
I've had that my whole life, but with
yeah,
MS, I have to be on meds. If I don't keep this one med titrated in
great,
my in my blood, I'll get it, and we call it creepy leg because my mom and my
yeah,
sister both get it too. So I'll get it so bad it actually does hurt after a while
yeah, it
because
hurts.
your leg is just jerking and you can't stop it, and it's so
Yeah,
awful. It's like
yeah,
it's
and you
very
can't
it's almost
sleep.
debilitating.
You can't
No, you can't
sleep.
sleep. You
So
can't, yeah, it's
yeah,
awful. So
yeah.
but yeah, allergies causing that is kind of different, but that's makes sense. So
Yeah.
anyway, but don't
All right.
wait. Yeah,
So today we're going to talk about
our doctors. We're going to talk
okay,
doctors.
and good doctors, bad doctors, educating
Yeah,
doctors. You
yeah,
know,
and
your best health advocate.
right.
So it's up to you too to explain what you need and how you want to be
Yep,
talked to, and
yep,
that kind of thing. So I'll let
yeah,
Amy start.
yeah. I mean, I'm thinking about it. Oops, sorry, because these days because I've got so many appointments, and I've had some doctors that I really appreciated and some I haven't. But my my first experience with the doctor that, or not my first, but one of my experiences was when Eli was first born. My son was first born. I was finding a pediatrician, and this one pediatrician that I went to like was talking to me like I had no clue. He talked. My cat's got the zoomies, so if
Oh,
he zooms around, he's distracting me. He's knocking things down, and he's
oh,
running around. Anyway, but he talked to me like I was so dumb and looked at me like, I would do something and he would go like condescending.
yeah,
That's the word I was looking for. So I knew I didn't want him. So the next lady was really great. His pediatrician as he got older was much better. And you know, so and this and I was telling Buck this story earlier, but the very first time when I first got diagnosed with MS, um, my neurologist that did the MRI called me in and he was saying, "You have MS." And I didn't know what MS was. And I thought it was like a death sentence. And I just had Eli, he was a year old. And I was like, "This is a nightmare. How long do I have?" And he said, "No, you don't understand. You're not going to die of it. You're going to wish you did sometimes, but you're not going to die of it. You're going to get, the worst case scenario is wheelchair by the time you're 40, and I'm 64 and I'm still not in a wheelchair, or 63, whatever I am. So I'm glad about that. And but after he told me, when he said you have MS, I went, oh my god, it's a nightmare, and I was crying, and I was like, how long do I have? I was crying this whole time, and he started to talk to my husband, like you're not talking to me. And I went, wait a minute, just because I'm crying doesn't mean that I can't hear and understand what you're saying. You have to talk to me. I'm the one who has the problem. You talk to me. So he was like, okay, okay. So then after that, he kind of respected that, I think, and
Right.
would then he would talk to me. But after a while, he would go, "How you doing? How's meds? You need anything?" And then he'd go, my daughter's having a real hard time. She's he would talk to me about his kids' problems, and I was like, I guess he thinks I'm smart enough. So, but that's to me that's a really important thing is that people talk to you like that your doctors talk to you from the start as if you can think, as if you are somebody who deserves the knowledge, who can understand the diagnosis, who gets it. And I wonder if there's a lot of people who just don't want that or whatever, because I don't understand why doctors just don't come in with that mentality, you know?
Yeah.
So, and I don't know what your experiences with that have been, but
Well,
when I,
today I had my psychiatrist appointment, and I
yeah,
really like her. She's
good.
the head of psychiatry for McGill for the bipolar uh,
Yeah.
in Montreal. So she's really great. She's French,
Yeah.
and
This is a great accent.
she
Yeah.
she talks to you, whereas in the
Yeah.
U.S. psychiatrists don't talk to
No.
you; they
Mo-
prescribe for you. They don't
Some
want to.
do, but most don't. Yeah.
Yeah,
You're right.
but she talks to me, and then
Yeah.
today, because I'm still having this sort of weak moments. I'm having weak moments. Like
Yeah.
Sunday, I went to see my premiere of a short film I did at Fantasia, at the museum.
Yeah.
And Fantasia is a big film festival
Oh, cool.
known worldwide. So the stairs are those deep stairs.
Yeah.
So I was having trouble like trying to. I felt like this really old man, and I had to sit down once because
Yeah.
I came down in the dark after going to the bathroom, and I had to sit down, and then I had to
Yeah.
map out how the stairs were to get back to my seat. But
Yeah.
and then walking back to the subway, I was just shaking.
Yeah.
So today we talked about. I said, this it's not going away. It doesn't
Right.
happen every day. It
But it
doesn't
happens
happen
and
every
it's
day.
annoying.
I have really good days. I said, but
Right.
this is not a natural progression for my age. Like
Right. Right.
I am not this person who's going to need a walker.
Right.
This
Right.
is the medication. So
Yeah.
we've been looking at different medications. So today she gave me options, and I said, well, the one that you think, to reduce this one medication and to
Yeah.
keep the other. And I said, so what? I mean, if that's what you think. She goes, no, what do
Yeah.
you think?
Right.
What do you
Yeah.
think?
You want to
She
try
goes,
it.
I want to know what you
Yeah.
think, because
Yeah.
this is going into your body,
Right.
and if
You
this,
get to make some. She's looking at you
right,
as a partner in your healthcare.
right.
Yeah.
She said, and if your mental stability starts to go, then you need to take back the medication
Right.
we're reducing. She goes,
Right.
is that okay? And I said, yeah. She goes,
Yeah.
yes. I said, yeah.
Say yes.
She goes,
Yeah.
because I'm writing all of this down and I want to make sure that we're doing. And literally, I was in the cab home, and because it's raining today, and 5 minutes into the cab ride, the
You got one of those.
pharmacy called me
Oh yeah.
and said, so she explained this to me, that you're going to take one of these pills out. So you're reducing the dosage for the, basically the bipolar.
Yeah.
So you're going to, and we're going to see if, and she wants to see if that works. And then I will help you with the plan for the, and I thought, you know what? In the United States, I never got any of this.
No.
The pharmacist called me 5 minutes later.
I know, that's nuts. It's really cool. Yeah.
I was like, I never got this in the United States.
And you know what? That's part of what makes a good doctor too, is they collaborate with your other doctors, you know?
Yeah.
So, I mean, that's one of the reasons I had a general practitioner that left. And then I started to get interns, the people that, not the residents, the one who kind of cycle
Right.
off. And I
Right.
got tired of having to go to different ones. So I went to this other practice that was close to the house, whatever. And I really liked my doctor. Her name is, uh, all my doctors have to have weird names. So I have Katz Nelson, I had Kovaleski, and now I've got Asimakopoulos. And you can't say, if you say Asimakopoulos, they'll go, what? Because her name is Asimakopoulos, and they'll correct you if you say it wrong. Anyway,
Right.
but I really like her, and she left the practice that it was in, so I was like, okay, I'll go to this other guy, and he was okay. I just didn't think he was as thorough. He wasn't as like interactive. He didn't talk to me about things, you know. So then he left, and I was like, okay, I'm not going back to that practice. If the doctors are leaving in that quantity, then something's up with that. So I found Asimakopoulos. So she's just farther away, but she's just in a different suburb. So I asked her why people were leaving there, and she said because the people the managers, you know, whoever runs the place, were like getting mad at people because they were taking too long with their patients and they weren't seeing enough patients in the day. So they were like, you have to only like spend 5 minutes with each patient, and any
Right.
more than that, you need like clearance or whatever. And she goes, I can't work like that. And
Yeah.
I was like, no, I don't want that either. And she goes, so I think that's why people are leaving there. So I mean, it wasn't like they were bad doctors or anything. It was perfectly lovely place. It was nice because like the blood work was in the same location, all that kind of stuff.
Right.
But if the doctors aren't happy, then you know they're not going to stay, and what's the
Yeah.
point? So, but I really like
Yeah.
her. She talks to me like, once again like I'm intelligent, and she'll just have a general conversation about stuff, you know, like because
Yeah.
so she's not a friend or anything, but she's friendly, you know. I have an
Right.
affectionate relationship with her, and I appreciate that. So not only and the other thing is that she knows my neurologist, and they both also have talked not only to my neurologist but my ophthalmologist, because I have to have an ophthalmologist because I've had like optic neuritis and some other
Right.
stuff that happened. So you know they talk to each other, and that's unusual too. I mean, unless they're in the same practice, like for them to talk to each other is sort of unheard of. So I just feel like I found the right doctors because they do things like that, you know.
Yeah.
So
Yeah.
you know, because most of them just don't. You
Yeah.
know, they just do the bare minimum. You know.
Yeah. I see my HIV doctor. She's actually just my doctor.
Yeah.
Um, and but she does research. So there's like 3 or 4 months where she's just completely gone. So,
Yeah.
but I schedule my appointments because you can get an intern if you want or
Yeah.
a resident,
Yeah.
but I want to see her and she
Right.
wants to see me, she said. So I schedule like every 6 months. Um,
Yeah.
if I'm sick, there's a
Yeah.
big nurses station next door with several beds and
Yeah.
chairs and stuff like that. So you can just go if you want.
Yeah.
You can call and make an appointment, but you can just go
Just
also.
show
You
up.
just
Yeah. Like
show up.
me.
Yeah.
Yeah.
Yeah. And they have a doctor that comes in. There's a doctor on call that makes the rounds through that. So, you know, but with her, she's very calm. She explains things very well. She's very personable. She's
Yeah.
funny.
Yeah.
The interns and residents that work for her um, are very pleasant. Very, they're just really nice. The
Yeah.
reception people are really nice. It's just at McGill Hospital, it's just very relaxed. It's
Yeah.
very, there's no push to get you out of there. There's no
Right. Right.
any of that. And the great thing about McGill, what you were talking about with your place, that the blood work is right there. So the blood work
Yeah.
is right there. Also, you can go get uh, a lung X-ray. You can go get just right there. There's
Right.
all these things that you can get
Right.
just right there.
Yeah.
So
My neurologist appointment. My neurologist. My where my. You know what? I just thought of it. The residents are the ones who cycle off. It's the attendings that are the ones who stay.
yeah,
So you want an attending doctor, but I just thought of that just now. But my GP doesn't have that, but my neurologist office has You can get your MRIs there. They have the blood work. I don't know if they have X-rays. I've never had one there, but they have all the different kinds of things are there.
Right.
So,
Right.
and so it's useful. I think they have a pharmacy there, stuff like that. So it's
Yeah.
good.
Yeah.
Just nice to have a all in one kind of place like that.
Yeah.
And they do have.
And
I think they have.
you
There.
get a referral slip, and you
Yeah.
just go over there. And again,
Right.
there's no cost.
Right. That's the other thing is, does my insurance cover them?
Yeah.
All
Right.
that stuff. And now that I'm on Medicare, it's like, okay, I know most places will take it. So,
Yeah. Yeah.
but it's crazy that we don't have Medicare for all.
I know.
But yeah.
Crazy
I like all the big
Republicans.
Western countries. Yeah.
It's a crazy Republicans.
Yep.
Not giving them free stuff.
Well,
It's like
and
your
telling
health.
I know.
Their
And
health.
everybody's going to need health care. Everybody's need
Everybody.
it. Everybody. And
Yeah.
it's
So
just
when your wife gets cancer, I guess you have to sell your house.
Yeah, well, a lot of people do. They go
'Cause
back.
they'll stop paying after
go
a while.
bankrupt.
Yeah.
Yeah.
So you'll have to sell your house. Are you willing to do that?
Yeah, yeah. Well,
Yeah.
yeah, because I don't want to pay for somebody else's health care.
Right.
And come on, the thing is, you already are, because the reason that prices are so high is because they have to. Hospitals can't turn anybody away. It doesn't matter. They have to take people. So they're going to. The cost goes to you and to your insurance, and that's why you do things like pay. Like my drug, my disease modifying med for my MS is like $9,000 a month. People go, oh, it's so expensive. It was like $200 for the month. I'm like, yeah, lightweight.
Yeah.
And I don't pay it, but the insurance does, and so I never understand why people. Well, I mean, it just doesn't make sense to me that people get so irate about having to pay for somebody else's health care, and that's the reason that they don't want universal health care. Or they'll say, well, you have to wait forever for a referral or whatever. I'm like, you already do now anyway. And I don't think you do. I think that it would be faster. And they go, well, but if you need an operation, they can put it off. And I go, if you walk in and you have to have your appendix out or it's going to burst, they will take you. Emergency med doesn't change. You might have to wait to get an elective surgery, but why is that different than now? And I would rather have the doctors who are paid by the government telling me what kind of, telling me about my meds than have the insurance company say, oh, you don't really need that.
Yeah.
Yeah. Yes, I do,
I mean, have these people never fought with the insurance company? I sure did.
I'm guessing not. A lot
just
of people.
For a year, and I was tired of it.
It's crazy.
I was sick of it. Well, we're going to drop you. Oh, this only pays for 80%. It was like, what?
Right.
What the fuck is a copay? And they were like, oh, well, you have to pay this amount.
You're not in Kansas anymore, or in Canada anymore.
I got a call from a doctor. I'm talking about the U.S. And like, the receptionist said, your insurance didn't pay the last 2 visits. I said, what? They refused it.
From someone,
like,
here's the thing: is they won't tell you how unless you research it, and then they'll go, "Oh, well, the code was wrong," or something. That you don't have control over. That's crazy.
I don't know. Anyway,
well, we're about healthcare, but
back to the topic.
The doctors. I mean, it's not that. The thing is, it's not the doctor's fault that the healthcare system is so messed up. I mean, they're just as impacted by this stuff. That they have to have outrageous insurance premiums because, and if it was, if it was universal health care, then you could still sue your physician, but it wouldn't be that they have to have this huge insurance battle for themselves either. Liability insurance is crazy.
Well, I had because my Blue Shield got dropped, which I didn't know because I did everything they asked me to do, and I got no notification.
Right.
And so when I went to a doctor, this is in New Jersey, he was really nice. Again, a really nice doctor who listened to you. you know,
Yeah.
and uh, and the whole facility was really, the receptionists were so funny, and we
Yeah.
laughed so much, and all the nurse practitioner and the doctor and the guy who did the epidurals,
Yeah.
came in a couple times a week or once a week. Um, and he just said, well, we'll just charge you 80%.
Nice. Yeah.
We'll
Thanks.
just take
Yeah.
80%.
Right.
He goes,
Right.
we won't ask for and he goes, stupid. He was from another country. He goes, stupid. This healthcare is stupid.
Yeah.
And he goes, it's just stupid. And so,
It is.
he said, I'd rather you came here, as scheduled, rather than, he said, people
Yeah.
just don't go to the doctor anymore because
Right.
they
Because
can't.
they can't afford it.
And he
Or
said,
they
it's just stupid.
It is
So,
awful.
yeah.
Yeah.
So I thought that was really, really nice. That was
Yeah.
a really great thing.
Yeah.
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 I had
Right.
when I started with HIV, I'll just go through this real quick. I went to Gay Men's Health Crisis, GMHC, in New York on 24th Street. And so I got a doctor, and he was terrible. He was really, really smart. I think I told you about him. He was a researcher from Yale. So this was his first time ever being a doctor. So
Like working
he put me
with
on this
clients.
medication, and the
Yeah.
medication made me, this is early medication. The medication made me poop and throw up.
Yeah.
So it just gave me diarrhea. So I went back to him and I said, I don't want to take this anymore. He goes, you have to. This is what they used to say all the time. You have to, because if you try something else, it might mutate, which they've since not, they don't say that.
Yeah.
So I said, well, I'm not taking it. And he goes, well, I can't give you something else. And I said, well, I'm not taking it. And I told him the story of how I went to a dinner party in Fire Island wearing white, and I had to turn around and go home. So I said, I'm not taking it, so give me something else. So he gave me something else. And when I got bacterial pneumonia, and I walked there all hunched over, and the nurse was like, we have to call an ambulance. And he goes, no, just send him home with some antibiotics. And the nurse said, no, he's going to die. So when I got to the hospital, the doctor said, you could have died.
Yeah.
So he finally showed up, my doctor from there, and he came in and he said, I'm really sorry. He goes, I didn't know it was. I said, you're a terrible doctor. I said, you're terrible.
Yeah.
You should go back to research. I said, you don't listen.
Right.
I said,
and
part of being a doctor is compassion and care.
Right.
And you just don't have that.
Yeah.
And I said, are you gay? And he goes, yeah. I said, but you're not HIV. And he goes, no. And I said, you need to understand what it's like to have this if you're going to be an HIV doctor. So eventually I left, and I came back because there was a woman that came in, and she Dr.
And she's good.
But when I moved out to New Jersey to the condo, I went to this hospital nearby, Riverside, and the doctor was okay. I liked my caseworker a lot. She was really, really great. So she got me, because I had depression. I have depression. She got me into a program in California under the Ryan White Scholarship. So I got a free thing to go to California. So for depression, and when you go and you're HIV, you have to be monitored by their doctor. And this doctor was Russian. And you have to do blood work and all this stuff. And he said to me, why are you on medication? I said, because I have to be. And he goes, no, you don't. He goes, your T cells are really high. He goes, like normal people.
Normal.
And I
Yeah.
was like, so I don't have to. And he goes, no. He goes,
Yeah.
you should give your body a break. This stuff is really toxic.
Yep.
So I did. And when I went back to New Jersey, the people at Riverside said, no, 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 you have to take your medication. You have to take it. You have to. We won't see you unless you do. So I went to Jersey Shore and I got the woman who was the lead researcher in New Jersey
Yeah.
for HIV.
Good.
So I went to her and I said, do I have to? And she looked at my blood work. She goes, oh, you don't have to take it. She goes, there's all kinds of crap in it now anyway, in the medication.
Yeah.
There's like Crixivan, and that's where people get big bellies and lose fat in their face. And she goes, just take a couple of years to see how you do.
Yeah.
So that's what I did. I didn't take any medication, but she listened to me, and the other people they weren't listening.
No, they just had their protocol. You're going to follow it, and if you didn't, then you were the problem. Instead of like, let me think about this. Other people have told you don't. Let me see how come.
Right.
Yeah. That's. I think bedside manner has become something that doctors realize is a lot more important than they used to think it was. Because they used to think that like they did. I read this a long time ago, but they did research on like what did doctors think that patients were, look for in a doctor, and it was the things that doctors said were the highest that people were looking for were things like where they got educated, whether they have like publications, how much research, all this like very technical stuff. And academic stuff. And when they ask people what they wanted, the main thing was good bedside manner. And so I think that when they kind of went, oh, I guess it does matter, how we treat people, and it was one of those like no-brainer things for the rest of the world. Doctors kind of, in this country anyway, they kind of get this like God status almost, like their word is gold, and it's they've come to a realization that that's not always accurate, that they they're just people like everybody else. They just have expertise that we don't have. That's all.
Yeah.
But it doesn't mean we couldn't. We just don't, And I have expertise that they don't have. That kind of stuff. In fact, I had one time I was in the hospital and I had one of the short coat doctors, the newer doctors, and she said something about we're going to put you on steroids, and I was on a medication that was like completely counterindicated with steroids. Like it would give you this thing called PML, which is progressive multifocal leukoencephalopathy. I know I've talked about it before, but anyway. But I said, I'm not going to take that. You're not going to put me on that because it's counterindicated with my medication. And I said, it will give me PML. And she looked at me blankly and I was like, she doesn't even know what that is. Well, good people, and I talked to one of the nurses and she said, they probably don't know what that is. You do know more about MS than they do at this stage.
Yeah.
And they're not learning about those. They're not learning pathological things. They're just learning like anatomy and basic treatment and stuff like that.
Right.
They don't have expertise on things, and not all doctors do. And sometimes you need to educate them, and they need to listen.
Yeah. When I was in New York, I had alopecia, which is your hair falling out.
Yeah.
And it would fall out in spots, and so I would go in. It was New York Presbyterian, and I would go in, and all these students would come in, and they were dermatology students. The doctor was like, "Can anyone tell me what this is?"
And they didn't know.
I went, oh my gosh, I just forgot my train of thought.
When the thought train without you,
I said areata alopecia.
Yeah.
And he was like, yes.
Who said that?
And I said, I did. And he goes, none of you knew that? And he goes, get out. Get out. So anyway, we have to wrap this up. So that was our topic this week. How do doctors deal with us, how we deal with them. And we will be back next week. I'm Buck.
And I'm Amy.
And we'll see you next week.